Let's talk about diagnosis versus no diagnosis. Now, so this is the principle I'll be using in answering this prioritization question. Now, on the NCLEX exam, right, it's expected for your prioritization option, right, the list of clients, right? You know, this is client one, client two, client three, client four. It's expected for each option to have the problem and what the patient is what experiencing, right? So our suspect is always the problem is what is causing what the patient is experiencing, also known as problem and what and symptom. Right. So yeah. But now, if you are seeing your answer keys, some have diagnosis and some don't have diagnosis. What the NCLEX is trying to send to you is that do you know who need assessment? Because a patient who already have diagnosis and a patient who don't have a diagnosis, it means that the patient who don't have a diagnosis need assessment. You need to assess them. The patient who have diagnosis is they need your help, but not as much as these clients who don't have a diagnosis. So it makes sense when you are on the NCLEX exam and you just spot that one or two option, or there's uh three option that don't have diagnosis, just eliminate that other option that have a diagnosis, because you are not going to prioritize that client 100% of the time on the NCLEX exam. So that is how it works. Now, when I was going through this particular question, right, it's an NCLEX pass question, right? So I looked at the first option. I saw this client don't have diagnosis, so no diagnosis. Now I looked at the second option, also no diagnosis. Now I look at the third option. I saw no diagnosis. I already knew my answer is going to be between one, two, three, because when I saw that these have diagnosis, I automatically eliminated that because of the principle. So it make no sense I should read what is going on. Right. It make no sense I should read, because the principle wants you to prioritize client that have no diagnosis over client that have what? Diagnosis. So now I've eliminated four. So I'm left with one, two, three. So now I just need to pay attention to what the client is experiencing. What the client is experiencing, so that I can be able to what? Prioritize whether the client is stable or not. Now, option one is saying bleeding, scalp laceration. Now, scalp is not deep. So, since it's a scalp issue, that is what? Surface. So, yes, deep is what we want to prioritize, but surface, now. So, scalp, the patient is still fine. And also, the NCLEX said they have the briskly reactive pupil, which means nothing is wrong with the patient. Neurological, there's no neurological symptom that's concerning, right? The patient is stable, the pupil is okay, right? So this will be out. Now, restless, distended, firm abdomen, there's a problem. So let me keep this option. Right, we have blood pressure 120, 76, pulse. That is normal as well too. So this is going to be out. So now we know our answer. Our answer is what? 2. You can see how the NCLEX work, right? So your answer is what? 2. So yeah, this is what you want to apply to most question, right? You want to make sure you understand a lot of principle. This one of a lot of principle that you can use in answering NCLEX question, the way that you will not struggle on the NCLEX exam. So if you love this particular video, like, subscribe to the channel. If you're watching from Instagram, follow my channel, share, save, right, and watch other video on the page or on the channel, so that you can learn more about how to answer NCLEX related question.